Hey everybody, this is Kara, and I'm going to talk about the solution that we came up with for combating homelessness in the St. Louis metro area. The solution we chose is called the Housing First model. The Housing First model is an evidence-based intervention, or an EBI, used to address the homeless epidemic. An EBI is a type of therapy that is designed and executed using proven research methods and empirical evidence. Created in 1992 by a New York City program designed to assist homeless folks called Pathways to Housing, Housing First provides an outline by which participating organizations can follow to ensure ample success as they aid individuals who are facing homelessness. The Housing First model is successful because it includes both prevention and maintenance. The fine print on this graphic reads, Housing First supports people who are homeless with living with mental illness by combining immediate provision and permanent housing with wraparound supports. The permanent affordable housing makes up the prevention portion, and the maintenance is made up of wraparound support services such as medical care, therapy, community involvement, etc. The idea is to first secure the individual's basic needs and then focus on support services in order to set them up for a long-term housing stability. Studies have backed up the effectiveness of the Housing First model. It's been shown that, compared to other models, Housing First provides faster and longer-lasting stable housing. Dr. Michelle Corns and her colleagues call Housing First the U.S. blueprint for tackling entrenched homelessness. Housing First runs on the premise that basic human needs should be provided before addressing anything non-essential to survival. In this approach, individuals are not expected to face obstacles prior to being provided with housing. Just like any other renter, they are not treated based on restrictions and conditions. Once they are assigned housing, they then have a choice to engage in the particular support services that they may need based on their situation. These services are not required, but instead offered as an option. When individuals are given the free will and autonomy to decide for themselves, their chances of success are much higher. They are acting intrinsically and not based on some mandate. The Housing First model is especially effective for folks who are facing particular obstacles in the housing process, such as mental illness, substance abuse, and other health conditions. Housing First has proved that homeless individuals facing these barriers would successfully surpass homelessness if given proper support. Instead of focusing on their particular obstacles, these individuals are treated just like anyone else before being given the chance to overcome their pre-existing barriers. Now I'll pass it on to Robert, who's going to talk about the advantages and disadvantages of Housing First.